You've probably been there, right? The doctor presses that cold stethoscope to your chest. But what are they actually listening for? Today, we're going to pull back the curtain and break down the heart checkup step by step.
Seriously, think about it. You're sitting there trying to breathe normally, and they're just listening so intently. But to what? What are the little visual clues or subtle vibrations they're trying to find? Well, today, we're going to step into their shoes and see this whole thing from their perspective.
So, first off, what even is a CVS exam? It stands for Cardiovascular System exam, and really, it's just the official term for how a doctor checks out your heart and your blood vessels. But don't think of it as just one single test. It's more like a detective story, you know? Each step reveals another clue about how healthy your heart is.
And of course, before any of that detective work can begin, you gotta cover the fundamentals. Every medical exam starts with the doctor explaining what they're gonna do, getting your consent, making sure you have privacy, and proper hand hygiene. It's the essential foundation for everything that comes next.
Okay, so the checkup officially begins with the most fundamental tool a doctor has, their own eyes. The very first stage is just a really careful visual inspection.
This first step is called inspection, and it's exactly what it sounds like. Before a stethoscope even makes an appearance, a doctor can gather a ton of information just by looking, searching for any visual clues that might point to the heart's condition.
And they start with the big picture. The actual shape of the chest or even the curve of your spine. Conditions like kyphosis, that's an outward curve of the upper back, or scoliosis, a sideways curve, can literally change the heart's position and affect how it works. It's just a wild reminder that everything in the body is connected.
Okay, now this is where it gets super interesting. After looking at the big picture, the focus narrows down to tiny little details, sometimes really far away from the heart itself. Things like the shape of your fingernails, a condition they call clubbing, or something called cyanosis, which is a bluish tint to the skin, can actually be huge telltale signs of cardiovascular problems.
All right, so after looking, the doctor moves on to their sense of touch. This brings us to stage 2, palpation, or as you and I would call it, feeling for the beat.
Palpation is just the medical term for examining something by touch, and the goal here is to feel the heart's impulse right through the chest wall. They're trying to get clues about its position, its size, and to feel for any unusual vibrations.
A really key part of palpation is finding something called the apex beat. That's the one specific spot between your ribs where you can feel the heart's thump the strongest. Now, if that beat has moved from where it's supposed to be, that can be an early sign that the heart is enlarged, which is a really crucial clue.
And this is where the descriptions get pretty wild. Sometimes, if a heart valve isn't working right, the blood flow gets turbulent, and it creates a vibration that's strong enough to feel with your hand. It's called a thrill, and the classic way doctors are taught to describe it is that it feels like a worm wriggling just under the skin. Feeling that is a direct signal of a significant heart murmur.
Okay, so we've used sight, we've used touch. The third stage, percussion, actually involves creating sound. The doctor taps on the chest to find more clues.
So why on earth are they tapping on your chest? Well, this analogy explains it perfectly. If you tap on a wall, it sounds different over a hollow space than it does over a solid wooden stud, right? It's the exact same idea here. Tapping on the chest helps reveal what's underneath. Is it air-filled lungs, a solid organ like the heart, or maybe even fluid?
And the technique itself is super precise. A doctor places one finger, called the pleximeter, flat and firm against the chest. Then they use the middle finger of their other hand as a little hammer or a striking finger to tap it sharply. And that quick lift at the end is really key. It lets the vibration ring out and produce a clear sound.
You know, it might look simple, but this is a skill that takes years and years to get right. For an experienced doctor, the chest becomes a kind of diagnostic drum, where every single tap tells a part of the story of the organs just beneath the surface. A resonant sound. That usually means air-filled lungs. Tympanic is more of a drum-like sound you'd hear over hollow organs. But a dull thud, that suggests something solid, like an organ or fluid. That dull sound is what they're listening for to basically map out the heart's borders.
And finally, we get to the part of the checkup that everyone knows, auscultation, which is, of course, listening to the heart with a stethoscope.
Now, a doctor doesn't just put the stethoscope anywhere on your chest. There are actually 4 very specific listening posts. And you can think of each one as a little window giving the clearest possible sound from one of the 4 heart valves: the aortic, the pulmonic, the tricuspid, and the mitral.
So what are they listening for? It's that classic lub-dub. The first sound, S1 or lub is the sound of the mitral and tricuspid valves slamming shut as the heart contracts to pump blood out. Then the second sound, S2 or dub, is the sound of the aortic and pulmonary valves closing as the heart relaxes to fill back up with blood.
That simple rhythm tells the entire story of the cardiac cycle. Lub kicks off systole, that's the powerful contraction that sends blood to the rest of your body, and dub marks the beginning of diastole, the relaxation phase where the heart refills. Lub-dub, lub-dub. It is, quite literally, the soundtrack of your life.
So, after all that, after looking, feeling, tapping, and listening, the doctor is finally ready to put all of these clues together to get the full picture.
So let's just do a quick recap of this whole multisensory investigation. It all starts with inspection, which is looking. Then it moves to palpation, which is feeling. That's followed by percussion, or tapping, and it all finishes with auscultation, or listening. Each step builds on the one before it, helping create a really complete picture of the heart's health.
So what seems like just a simple routine checkup is actually this incredibly sophisticated process of solving a puzzle. Every single observation, from the shape of your chest all the way to the lub-dub of your heart valves, is a crucial piece of that final picture. It's a pretty remarkable diagnostic story, revealing the tale your heart is telling without it ever having to speak a single word.